one by storm. This is my pun for the day. I got one laugh out of there. So look, let's start with this. As many folks know, today is the first day that different business sectors across the state, we're allowing them to flex open under new guidance with additional services. Barbers and hair salons may open starting today and by appointment only. Retail stores across New Hampshire now have the ability to expand beyond curbside pickup and delivery to offer in-person services with a 50% occupancy of those retail facilities. Golf courses were able to open this morning to New Hampshire residents and members of those clubs. Even drive-in movie theaters we're allowing to open under new guidance and some restrictions. So all areas and industries where steps are being taken have been signed off by our public health team. That's a very important aspect of everything that we do, being hand in hand with Dr. Chan and his entire team at the Department of Public Health. Of course, many stores and barbershops may choose not to open yet, and that is just fine. We understand that these guidance documents that we've prepared may not work for everyone given the timing, but we want to provide that flexibility for those that choose to do so. Those that choose to reopen may continue to request face coverings from the state, and we're sending out thousands of orders over the next few days. And as a reminder, you can request some of those face coverings for your business at nheconomy.com/COVID-19. That's nheconomy.com/COVID-19. Moving forward, the Economic Reopening Task Force is continuing to explore additional areas that may be able to open in the coming weeks. And as we continue to evaluate and solicit input from the Reopening Task Force on what areas and steps we may be able to take next, we want to ensure that we have a continuous and robust testing program. That's obviously an important aspect of everything we do here, a very important tool in the toolbox. We've been able to drastically increase the number of tests in the state and the availability. In a little bit, we're going to have the commissioner come up and give a bit of update on testing. But first, let's start off with a public health update from Dr. Chan.
Good afternoon, and thank you, Governor. Just a couple quick updates, both the numbers as well as to stress the need for ongoing social distancing despite stay-at-home 2.0. So globally, there's now more than 4.1 million cases of COVID-19, including more than 1.3 million cases in all of the United States. We have tested in New Hampshire more than 34,000 people for COVID-19, more than 34,000 New Hampshire residents. And in the last week, we have averaged over 1,200 tests per day, and we will continue to work on increasing testing. To date, we have identified a total of 3,160 people diagnosed and confirmed with COVID-19. That's an increase of 89 people from what we announced yesterday. 318 of those have required hospitalization at some point in their illness. That is an increase of 3 individuals from what we reported yesterday. And we have 133 people who have sadly died from COVID-19, either directly or related to COVID-19 complications. That is an increase of 0 individuals from what we reported yesterday. However, there are a number of deaths that are currently undergoing investigation, and so we can expect this number to increase in the coming days. So I think as we experience and go through this pandemic, this outbreak in New Hampshire, it's becoming clear that COVID-19 will likely be with us for many more weeks, if not months. We have been successful at limiting the spread of COVID-19 with our community mitigation and social distancing measures, but there are likely a large number of people still in our communities who have not been exposed and may not have some evidence of immunity, and therefore, as we begin to talk about reopening various businesses and sectors in our society, we have developed guidance to build protection into those reopening processes. And especially businesses that may even increase operations, we are trying to build protection into those processes to prevent spread of COVID-19. It is important for businesses to comply with that guidance to the extent possible, but at an individual level, I want to stress again that people still need to stay at home as much as possible. There's a need when people are out to maintain social distancing, so please, when you're out in public settings, maintain a safe distance of at least 6 feet from other people at all times to the extent possible. And please, we recommend and strongly encourage people to wear a cloth face mask if they're in public settings where social distancing may not be possible or may be difficult. And as always, please practice good hand hygiene. This is important particularly for older adults, and people with chronic medical conditions in our community, in whom infection is more likely to lead to complications such as hospitalization and potentially even death. We collectively as a society need to protect the more vulnerable individuals in our communities, particularly by not visiting people that may be more vulnerable. This can be difficult, especially when we have been undergoing social isolation potentially for weeks, if not months. But this is important to continue to protect those in our society who are more vulnerable. This includes not visiting family and friends who may be in long-term care facilities or assisted living facilities. We've been getting questions about what Stay-at-Home 2.0 means for people that may have family or friends in congregate living settings like nursing homes and assisted living facilities. And I just want to stress that the guidance and restrictions that have been put in place in these long-term care facilities still very much remains in place. We still very much need to protect those in our communities who are more vulnerable, where, again, COVID-19 infection could lead to hospitalization and potentially even death. And so we are continuing to work with facilities to rapidly identify and try and contain outbreaks in these facilities. But it's important for everybody in our society to continue with the social distancing to the extent possible, maintain a safe distance from other people when out in public. Please wear cloth face masks, and as always, practice good hand hygiene. And with that, let me hand things over to Commissioner Shibinette for some additional updates. Thank you.
Thank you. So testing update for today. Overall, we're still averaging about 1,200 tests a day. Over the weekend and late last week, after announcing our 5 fixed sites and our mobile testing between Thursday and Sunday, the state teams did almost 2,200 tests at those sites. We opened a new site in Milford late last week, and we will be announcing a new site in Concord later this week. Clear Choice MD from Friday at press conference time through end of day last night saw about 975 patients for a combination of both PCR testing or active infection testing and antibody testing, with the majority being a combined testing sample. So that's my testing update. Long-term care, we have a couple of outbreaks to report on. Today we are reporting 2 new outbreaks, one at Hillsborough County Nursing Home with 12 residents affected and 2 staff for a total of 15. And one at Community Resources for Justice, which is a transitional housing program for adults with 11 residents affected and 3 staff. Additionally, on Friday, I announced that in response to some of the reports that we have received about long-term care data, that we were going to pull different data from different sources and take a look at how New Hampshire was doing in fighting the COVID fight in our long-term care facilities. So we pulled data from our state's licensing data bank, other states' databases, and the Kaiser Family Foundation to look at how we were doing with our strategy and our vision on fighting COVID-19 in long-term care. So what we found, a couple of the data points that we pulled, for example, long-term care facilities, the percentage of long-term care facilities with active COVID cases is one of the things that we looked at. How are we doing with preventing it from getting in the front door, which is what I've said all along, is that that's what we need to do. So currently, for long-term care facilities in New Hampshire with even 1 case of COVID, we're rated at around 21%. Rhode Island is at 33%, Maine is at 43%, and Massachusetts is at 49%. The other data point that we looked at was when it comes to long-term care death, the percentage of our long-term care residents that we've lost to COVID-19. As a comparison, Rhode Island has lost 5% of their long-term care population as compared to licensed beds, Massachusetts 4.6, Connecticut 3.2, New York 3, and New Hampshire 0.7. So what's important here is that the department develop and use relevant data to change the narrative. It's not whether New Hampshire is the worst or the best when it comes to the number and the degree of long-term care death. It's that every death is unacceptable. Every death represents a grieving family and a devastated family, and it really needs to inform how we strategize and how we develop solutions to the long-term care COVID-19 crisis, because that's what it is. So, since the beginning of COVID-19, we've really worked hard at developing an aggressive testing strategy, an aggressive containment strategy. Stop it at the door, screen everybody that comes in, test the entire unit when someone comes back positive. And I think that that testing strategy is working out, but it's never good. Like I said, every single death is a tragedy for our residents. So we need to keep on doing everything we can. And I know that all of our healthcare partners, whether it's our physicians, our long-term care centers, state DHHS, everybody that works in long-term care is working very hard to prevent every single one of those. Thank you.
Great. Thank you very much.